At this time, I'd like to introduce Lisa Friedman. Lisa has joined us. She'll be the moderator of the first panel discussion, which is strengthening the crosswalk between climate health and environmental policies. Lisa is a reporter on the climate desk for the New York Times, focusing on climate and environmental policy in Washington. Welcome, Lisa.
Thank you so much, Madam Attorney General, and thank you, David, Richard, everyone for having me. I'm so excited to be part of this panel and to be going deeper into a lot of the issues that we just talked about with who I think are some of the smartest people in this field. We have with us today, this morning, a truly outstanding panel. I'll just give the briefest of introductions because you have them all on your sheet. But we have with us Dr. Aaron Bernstein, who constantly reminds me to call him Ari and not Aaron, the Interim Director for the Center for Climate Health and the Global Environment at Harvard T.H. Chan School of Public Health. Dr. John Holdren, former science advisor to President Barack Obama, and the Teresa and John Heinz Professor of Environmental Policy at Harvard Kennedy School of Government. Gina McCarthy, the former administrator of the EPA under President Obama and the president and chief executive officer of NRDC. And Dr. Sudeep Parikh, the chief executive officer and the executive publisher of the American Association for the Advancement of Science. Welcome, all of you, and thank you so much for joining us today. Is everybody online? Okay, I'm gonna keep going. We're going to cover a lot of ground in the next hour. We're going to talk about the links between climate and health, how we communicate it, what we're doing or not doing right now on a federal level, what policymakers can be doing locally, and what stands in the way of action, and how we can work around that. I thought that video, Mara, that you showed was really just astounding. And I was going to open, Dr. Holdren, with you, asking you to describe the range of ways that we know how climate change is affecting health. But given that terrific video, maybe I can ask you to zero in on some of the major intersections of climate and health where you think the federal government should be really focusing its attention right now. Uh-oh. Are we?
John, I'm sorry, you're muted.
I thought somebody has to unmute. Okay, there we go. I had been muted by the host. Can you hear me now?
Yes.
Okay. So thank you very much, Lisa. Let me do my best with a big charge. Until about a decade ago, most scientists thought that the biggest direct impacts of climate change on human health were going to be, first, the spread into higher latitudes of tropical and subtropical diseases, things like malaria, dengue, cholera, West Nile virus, and so on. And secondly, deaths in heat waves, particularly among the elderly trapped in the world's cities. Also on the list of health impacts that were expected to grow under climate change were deaths and injuries from hurricanes and typhoons of increasing power and from more widespread flooding caused by the torrential downpours that are associated with the higher water content of a warmer atmosphere. Also frequently mentioned were diseases from pathogens and toxins unleashed by coastal and inland flooding, increases in deaths and illnesses from air pollution made worse by changing atmospheric conditions, and worsened allergies because of climate-driven increases in pollen. Today we understand, I think even more clearly than before, that all of these climate-linked health impacts are important, and some of them have been growing even more rapidly than we feared before. But two other impacts on human health have risen even faster in scientists' estimation of the harm from climate change. The first one is heat stress and heat stroke from increased heat and humidity outdoors. We now know that the combination of heat and humidity in the warmer parts of the world has already reached levels in the warmest months of the year that make it impossible to work outside or even be outside without risking heat stroke. And the areas and durations over which this is happening are expanding frighteningly. The second of these recently upgraded hazards in our estimation is health damage from smoke pollution from the wildfires that climate change has made much bigger and more powerful in many parts of the world. In the last few weeks, most of us have already seen in the media that the fine particulate pollution in major parts of the American West, driven by huge wildfires, has been worse than the notorious particulate pollution in Delhi and Beijing. Other impacts of climate change on public health that have the potential to become catastrophic include malnutrition resulting from declining productivity of agriculture and marine fisheries in many parts of the world, and diseases spreading among densely populated and unsanitary camps housing climate change refugees who have fled their home regions after climate change made these unlivable. If there's any silver lining in all of this, it's that increased public understanding about ongoing as well as potential damages to their health by climate change is lifting up the political salience of the climate issue, and so increasing the chances that society will take the actions that are needed to address it. Thanks.
Thank you, John. Dr. Bernstein, let's focus on COVID-19 for a moment. Your team has really been at the forefront of some of the groundbreaking work linking COVID-19 vulnerability to death from COVID-19 with long-term exposure to air pollution. Could you tell us a little bit about that study specifically and what we've learned since then?
Sure, Lisa, and I just want to acknowledge how grateful I am to be able to share the session with you and John and Parikh and Gina, and for Stuart for reaching out to me, and to Attorney General Healy and Melissa, whom I've worked with in their tireless efforts on these issues in our home state of Massachusetts. You should all know I'm actually a practicing pediatrician. In fact, most people would identify me that first before my affiliation with our center at Harvard. And you know, I think the issue you raised, Lisa, around air pollution and coronavirus is one that colleagues of mine at the School of Public Health really dove into very quickly. I was not directly involved in the research you cited, but I do know the investigators pretty well. These are folks who have spent their careers trying to understand the effects of air pollution on health. The study was led by Xiao Wu and Rachel Nethery, and the senior author is Francesca Dominici, and they looked at air pollution over the span of a decade or more in counties across the United States, and found that in places where there had been more air pollution, very small increases on the order of 1 microgram per meters cubed. So as you heard about from John and others, the air pollution in the West right now, the levels of particulate matter in the air could be 80, some cases over 100 micrograms per meter cubed. So a long-term change in 1 microgram per meter cubed was associated with an 8% increased risk of dying from coronavirus. Now, the authors would be the first people to tell you that their study alone is not evidence enough to rush to a conclusion about the effects of air pollution on dying from the disease. But then, of course, we now have over a dozen other studies that have found similar findings, including a study that was published just last week, again in the United States. And these are studies around the world. They have different methods, they use different study designs. And many of these studies are not the best sorts of studies to prove causation, but we also know that air pollution causes diseases, very definitively causes diseases like heart attacks and strokes and other medical conditions that are strongly associated with people dying of coronavirus. So whether you look at it from the direct effect of air pollution on the risk of dying from the disease or its effects through causing other diseases, there's a strong risk. And has already been mentioned, this is a huge problem because it strikes the people who have been historically left behind. The air pollution in the United States disproportionately affects people of color. And it's not just that Blacks and Latinx communities are exposed to, in some studies, 20, maybe 60% more air pollution. They produce less. They're responsible for less. Their behaviors in our society actually consume less goods and services and energy, so they're producing the least and exposed to the most. And then, of course, we hear the data that Attorney General Healy referenced about the outstanding and horrifically outstanding higher mortality rates in, for example, the Black community in the United States, 2 to 3 times higher. And we're left to wonder, are we looking at the long tail of redlining in the United States with some of these COVID outcomes? And I think it's critical to recognize also that the pollution that we're talking about is driven by fossil fuels, particularly in cities from transportation, increasingly so. And as my colleague and friend Ashish Jha mentioned in his remarks, we know that we can take actions to get off of fossil fuels and not only reduce the rates of diseases like heart attacks and strokes, we may in fact reduce severity of disease with coronavirus, and we can take anti-racist actions. And so it's, we've tried to connect these dots between climate action, pandemic actions, and equity actions, that these solutions, in fact, get at all of those with the same activities.
Thank you. I've been told there was a little bit of a funny noise when I was speaking. I took out my earbuds. I hope this has helped it for the crowd. I'm going to circle back to those equity issues with Administrator McCarthy in a moment, and I really want to go deep into that. But first, before that, Dr. Parikh, just sticking with this science around COVID-19 and exposure to air pollution. I mean, this study was attacked immediately by the Trump administration EPA, by the initial study, by Republicans in Congress. I'd like you as a nonpartisan science organization that has been working with both sides of the aisle on science issues to talk about your experience with the growing partisanship around science in the case of this instance, COVID and air pollution, climate change, and how this affects the ability of groups like yours to work towards solutions.
Thank you, Lisa, and thank you everyone for the invitation to speak on these issues. These are really challenging times to be a nonpartisan, thoughtful purveyor of scientific information, and that's the first thing I'll say. AAAS is 170 years old. Throughout that time, we've really worked to try and build trust with parts of the society that are outside of science. So we have programs that put scientists in congressional offices, scientists in newsrooms around the country. We have programs where scientists meet with members of the faith community. We have programs where we talk about climate change with judges. And that's all been happening for decades. And we have relationships that are built and that are strong on both sides of the aisle. The challenge in this moment is that those are under incredible strain. So the moment that we never sacrifice credibility or truth or facts to keep those relationships. And so we speak the truth. And so when we say that climate change has health effects, climate change has human origins, we do face blowback, and we face it's rare that as AAAS we get called a leftist organization. That's happened in the last couple of years, and that's a really it's a strange place for us to be as an organization. That said, we continue to play the short and long game. We continue to have relationships, and the thing that a lot of the folks on this video conference know is that Washington has many layers of relationships and interactions ongoing all the time. And while there's this white hot heat of the political moment, there's continuing conversation on both sides of the aisle about science. Even in this during this last 4 years, the funding for science has increased quite a bit for many agencies, not the EPA. We can talk about that. But there is support for science across the spectrum. We just have to find ways to work together. And I can talk about some of those ways later on, Lisa, but it is very much a challenge right now.
That's a great opening. And you and I have talked about some of the ways that you're working with local communities to get around some of the white hot debate in Washington. And I definitely want to come back to that. But I want to turn now to Administrator McCarthy. I would love for you to go deeper into this issue of environmental justice. Walk us through why and how Black and brown communities, frontline communities, are more vulnerable to illnesses related to air pollution and climate change, and what are the things that we need to do to address it at a systemic level? I'm reading that Gina is not able to get her video started. Oh dear. Okay. Well, let me turn that question for now to you, Dr. Holdren, and hopefully Administrator McCarthy can join us in just a moment. Dr. Holdren, can you talk us through some of the ways that we can start to address this systemic racism that is embedded into the system of how and where we build industrial hazards and polluting industries?
Well, as a start, we have to recognize the problem, and that is now finally happening. I mean, I have been aware for many decades of very capable people working on the issue of environmental justice and pointing out the extent to which communities of color, various ethnic communities, folks who have already been pointed out, produce much less of the problem but bear a higher share of the impact. But only really recently has this understanding, I think, started to pervade the society more widely. The understanding that poor people, that Black people, that Hispanics, that Native Americans are all subject to far more than their share of the pollution generated by fossil fuels and indeed a variety of other pollutants. And that the only way to fix this is to address the fundamental problems of racism and injustice in the society, including by taking much greater measures to lift these groups out of poverty, to lift them out of the discrimination that they have suffered. And at the same time, we can't forget that even the best off people in our societies are vulnerable increasingly to the impacts of climate change, that everybody's going to be affected, and that therefore an important part of the solution has to be addressing the climate change issue head on and addressing the panoply of other pollution issues head on. In respect to climate change, the United States needs to start by rejoining the Paris Agreement. The Paris Agreement, of course, was only a first step toward what needs to be done, but it was a big first step. It was an important first step. And of course, President Trump, very shortly after he became president, announced that the United States would withdraw. That doesn't formally happen until early November, but he terminated immediately essentially all of the steps that the United States was taking to comply with the commitments it made in Paris. We've got to reverse that. And pretty obviously, the only way to reverse it is going to be by electing a new president, electing Joe Biden. And at the same time, I believe that the new president I'm hoping for, a President Joe Biden, will take a range of other steps needed to address the specific problems of racism and inequity in the way people are exposed to the hazards of climate change that are being discussed here.
Thank you, Dr. Holdren. Just wondering, is it possible, I don't know, Administrator McCarthy, if you can hear or if you're able to join by audio, even if the video is not working? Okay, I think unfortunately for us, we are not going to have her on with us. Hopefully something will change in the next little bit, but for now let's continue. You know, so this is for either Dr. Parikh or Dr. Bernstein, you know, whomever, you know, would like to take this. Can you walk us through, I mean, if the federal government rejects science that shows the link between air pollution, climate change, and illnesses or premature death, who is helped by that? Who is protected and how? And, you know, is it plausible at this point that we don't know enough about these links to take action, which is what, you know, this EPA has been suggesting? You know, so sort of a two-pronged question. I mean, walk us through how this protects, I assume, industry by not recognizing these scientific links, and what, you know, whether it is accurate or not that we really need more information before we move forward with tightening regulations on air pollution. Maybe if I could ask Dr. Bernstein to...
Sure. Well, if I had to channel my inner Gina McCarthy, since she's not here, but she can yell at me later if she doesn't like it. You know, one of the lines she likes to use is, you know, this current EPA has shown a great affection for protecting the polluters, but not for protecting people. Oh, there she is. She popped in for a second.
Oh, do we have her?
Gina, I was just quoting you since you weren't able to join, but since you're here now, I think we can let you chime in. Gina, I was just channeling your thoughts on the question that Lisa had asked, and I don't know, Lisa, if you want to re-ask it about.
Yeah, I'm happy to repeat the question. Thank you for joining us, Administrator McCarthy. We're so happy to have you.
I am so sorry I got a little bit delayed here. I couldn't get the camera to work, so it must be my lovely face.
We are all doing our best with work from home and Zoom technology. Be prepared to hear my puppy bark any minute now, friends. Administrator, I was asking if you could, you know, what I'd love for you to do is sort of walk us through who the winners are if, you know, the federal government rejects studies, as it's doing, that shows the link between air pollution and illness and premature death, or climate change and health. We've talked a lot about who is hurt, but who is helped here? Who is it that's protected? And as a related question, I was asking, is it plausible at this point that, as the CPA has argued, we don't know enough about these links to take greater action?
Well, it's a bit shocking to me that anyone could still have the view that we don't know enough. Because the data has been clear for years. You know, one of the most interesting things that I found during the COVID-19 epidemic was everybody's surprise when they found out that, you know, that Black people were much more severely impacted when they were exposed to COVID-19, dying at a 2-to-1 average when compared to white people. And you know, we've known that in the environmental community forever. That's why we talk about frontline and fence line communities. And so the only benefit that I can see to denying science are to people that like things as they are. In this case, it would be the fossil fuel industry understands that if you can deny the science long enough, then you can delay actions that may disbenefit them in terms of their view of what keeps their corporations functioning. So to me, what you're seeing happening now at the federal level is an administration that cares more about polluters than people. You know, they are clearly protecting what they consider to be their base, and shifting how the government would normally look at science, would normally respond to it, and would normally make policy shifts, not complete abdication of their role and responsibility. And they've just chosen to make sure that they send the right signals to polluting industries that they shouldn't have to change. And science is a fundamental way of ensuring that change does happen as we learn more. So we don't win. And frankly, the people in corporations don't win, but those who intend to make money out of it, as opposed to protect people, do win, at least in the short term. But when it comes to climate, it's one planet. We're here to protect the planet because we care about the people. So they don't win in the long run if they want to have a healthy life, or if they want to hand their children a future to be proud of.
And since I know we have to lose you a little early, I'm going to keep you on deck for another moment if I could. One of the most controversial pieces of regulation that is still being finalized, we should be seeing it, maybe this month, is a regulation that the EPA calls the Strengthening Transparency in Science, in Regulatory Science. Folks in the science community have called it the secret science regulation, with air quotes around secret science. Administrator McCarthy, so the short version of this, I'll explain to viewers. The administration would like to discount studies in which the raw data is not provided when it chooses what studies to use to make or strengthen regulations. Administrator McCarthy, can you talk about this regulation and why you find it so problematic, and why so many people in the scientific community do?
Yeah, it's really funny, Lisa. This was one of those rules that I think they thought they could easily get through because it's been lingering for a while. And I think they thought that because they basically kicked out a lot of the scientists off the Science Advisory Board that could provide real scientific advice. And they put a lot of industry representatives that were scientists on the committees, thinking that this would be an easy thing to just keep rolling through the dismantling of all these rules. And in fact, they found that even their hand-stacked Science Advisory Board was saying, hey, now wait a minute, this is really going too far. Because basically, as you indicate, what it does is it's not about transparency. Transparency is great. Data sharing is wonderful. But they're just defining it in a way that doesn't allow real science to be considered. That is their only purpose in doing this, is to dismantle, and Ari can speak to this more, one of the fundamental and premier scientific work that was done to show that pollution in the air causes really direct and severe health benefits, which we now know more and more about, was called the Six Cities Study. And it was really a longitudinal study over a massive amount of individuals that gathered enough data. And this has been something they've been yapping about for a long time, the folks who don't want this to continue, that gathered a lot of data that really proved that air pollution causes really serious health consequences. And that was used as an underpinning for the Clean Air Act to regulate all kinds of sources to reduce those emissions that cause that damage. And it allowed us to basically value and calculate the benefits of those reductions in a way that allowed us to have very cost-effective ways of pushing the utility industry to get cleaner and cleaner. And what they're trying to do with this rule is to rule out that study because it would reveal, it would continue to allow us to regulate. But the problem is that revealing that data would require us to reveal data at levels that would personally reveal data that mattered to human beings, individual. That would be precluded from being publicized and given to the public. And this has been going around, Lisa, for 10 years. This came up first maybe 15 years ago. And the EPA actually paid $3 million to hire 30 million scientists, really great people from the Health Effects Institute, to relook at all of the raw data and to independently evaluate it. And they came up with essentially the exact same scientific opinion about the relationship between air pollution and health impacts. But apparently that wasn't good enough. We're supposed to hand to everybody public information about people's medical, history as a way to somehow bring more transparency, which we all know is ludicrous. It'd just be a food fight to all those who want to misinterpret it and to wreak havoc, instead of leaving it in the hands of scientists who have access to all that raw data if they want to ask for it and will use it in a proper way. So it's not precluding transparency in way, shape, or form. It's clouding clear science, and it's taking away our ability to rely on good science to make decisions that are essential for protecting public health and the environment.
Thank you.
Other than that, it's a terrific idea,
Well, I mean, so just turning for a moment, Dr. Parikh, to you. I mean, a number of the studies that Administrator McCarthy referred to, epidemiological studies, longitudinal studies of the effects of exposure to people over time. Can you, a lot of the studies that are really being targeted here, not just in relation to, I know we're here to talk about the link between climate and health, but also pesticides and chemicals are also, I think under fire in this administration. A lot of the studies that they're targeting are epidemiological studies, recognizing that much of the audience are public health professionals, but for those of us who aren't, can you explain why epidemiological studies have come in the crosshairs of industry and conservatives when it comes to regulating both air quality, chemicals, pesticides?
Well, they're powerful data. They're compelling. Epidemiological data tells you what health effects there might be in a large population, and it shouldn't be about the individual. And so, as AAAS rarely takes such definitive stands on issues like this, but this was one where it was so clear what would happen without access to this data, without access to these studies. In the performance of making regulation, that it was clear for our board that we had to speak out directly and call a spade, which is to say it's almost Orwellian to call it transparency. It's the opposite of that. And so the epidemiological data that really would inform not just the current regulations that are there, but frankly, as you look forward, there's more and more of this data that will be coming to us. We have we have wonderful studies that are ongoing at the NIH and at in the VA that hopefully can also provide more data that can be valuable for making regulatory decisions. And this is a prelude to that. And so at AAAS, we view it as this is not putting data and science at the decision-making table. And that's what we're about. We have to have data and science at the decision-making table. And when it's there, then we can have an argument about it. But let's make sure it's there first. Let's not take away the data and then try to have an argument without it.
Thank you. Dr. Holdren, we're seeing dismissal of science in a lot of areas. You've recently, the National Academy of Sciences, more than 1,000 scientists called on policymakers to restore evidence-based science making, especially when it comes to challenges like the global pandemic, like climate change. What areas worry you most right now as you look at the administration and how it is using or not using science?
Well, let me say a couple things. I first want to make one addition to what Gina McCarthy already said. And that is, in the conduct of these studies, like the 6 cities study that she mentioned, binding agreements were made by the investigators with the individuals whose medical records were used. And to release the raw data containing individual medical records to the public would violate those agreements. And this is part of the whole preposterous character of this transparency proposition that the advocates of clouding this issue have put forward, that it would in fact violate the agreements under which the studies were done to make public the individual information that became part of them. In terms of what worries me most, I have to say that the overarching issue has been the replacement of people at and near the top of our departments and agencies with science and technology responsibilities with people who are basically anti-science, who are deniers of the realities that science has brought forward. And the result of that substitution, along with the dismantling of many of the key advisory committees, has simply cut science off from the decision-making process in these agencies. It's happened at the EPA, it's happened at the Department of Interior, it's happened in the Department of State, and there's now reason to worry that it could even happen in NOAA. It's happened in such a pervasive way that when people ask me what is the first thing we need to do to restore integrity and the applicability of science and technology information in government, is we need a house cleaning. We need a president who will appoint people with real expertise, with relevant experience, with commitment to the public good to these positions. And what worries me above all is the further damage that will be done if we have another 4 years of know-nothings running some of our most important science and technology agencies.
Thank you. You know, I want to take this opportunity to tell the audience I'll be happily taking questions from the audience in a bit. If you would like to use the Q&A to type your questions, I'll be taking a look in there. Dr. Perry, tell me, you know, I mean, just some of the, you know, the partisanship and the rejection of science that Dr. Holdren was just talking about has led you to start increasing your focus at AAAS on state and local governments. Is that an accurate? Tell us a little bit about the work, about why you're shifting to working with local governments and what you're doing.
Sure. We continue to work at the national level, so that doesn't stop. It's incredibly important. But what we found is that while these hot debates are happening in Washington, we can have more of an effect by building that trust and building those relationships at the local level, where there may be either more openness because the political leaders are open to science or more open to science, or because there is such a challenge, such an acute challenge, that people are willing to work together, even if they don't necessarily agree on the root cause. So I've talked a bit about some of the work that AAAS has done in terms of communication on issues of climate change. The first was, you know, what do we know? What do we know as scientists? And trying to put as much fact into place as possible. And then how do we respond? In that How Do We Respond campaign, we worked with people at the local level who did not believe that climate change was causing the particular local acute problem they were facing. The lack of fish in their streams, the change in water temperature in their lakes. But they realized that scientists were part of the solution to these problems. And so we're able to build those relationships of trust that hopefully over the course of years can build more and more over time, so that trust leads to eventually trusting us on the bigger issue as well. It's a long game, and we want to make progress. And so we do this, you know, we want to make sure that we take advantage of of that relationship now and in the future. It's not a replacement for change at the national level. it is a Band-Aid. It's working to change some hearts and minds at the local level, but it's definitely not a solution at the global level.
I think that's a really key point too. Yeah, you're right. And you know, just going back to the transparency rule, one point that Gina raised to me in a note just now, and you know, I think this, you know, maybe she or Dr. Bernstein can speak to this. I mean, if, you know, are other agencies, what would happen if other agencies, the FDA, the NIH, were asked to employ the same level of transparency, provide the raw data, the medical history, the you know, medical information of all the respondents in a study before they move forward? Is, you know, I guess there's a couple parts to that question. Is that something that could happen, or are those agencies operating in a different way, and that wouldn't be a factor? But what would, you know, what would the conclusion be there? Would that not allow us to create vaccines or other protections? You know,
Lisa, I'm thinking on the fly here, so I will look to fellow panelists as well. But NIH, not being a regulatory agency, it's a slightly different animal in that at the research level, there is sharing of data. But again, you know, all the rules of privacy, all the rules of human subject protections are in place at NIH. And again, you're not making regulatory decisions at the NIH. For the FDA, there you're looking at a different set of data that does not include individuals that the FDA is looking at. And I don't, again, look to my fellow panelists, but they're not looking at individual data for making decisions on clinical trials. They're looking at the data that comes to them from the DSMB and the other panels that look at this first on the outside. So again, I think that would be really, really horrible if the FDA were having to look at individual records of individual patients. But again, I'll turn to my fellow panelists as well.
Dr. Bernstein, Administrator McCarthy, any additional thoughts on this?
I guess, Lisa, the point I was making is if it's required to have this level of transparency for science to be considered by a federal agency, why is EPA the only one that has that requirement? And if you step back and say to yourself, okay, do you think chemical manufacturers who want their new products to be brought to market would be willing to live with that same scrutiny? What about people who get tested for new cancer treatments? Do they really want their work to figure out that they have cancer? Do you know what I mean? There are many layers of this. And it's funny how people think some kind of regulatory agency should be held to a different level of scrutiny on what sound science is than scientists in the federal government are held to. So I do think there's ramifications here that made EPA pause and think, should we really rush to this judgment in our effort to try to undermine regulatory decisions and our ability to make these connections that are central to good regulation? Are we really going to undermine way more than that? And I think given that EPA regulates chemicals that industry brings to market, or whether they bring them to market, it's a slippery slope that they have to worry about by talking about this as if this is the distinction between good and bad science.
I think I'm going to use this opportunity to segue and keep you for a moment, if I could, on co-benefits. You know, co-benefits is also something that this administration has taken aim at. Explain to us how the EPA under the Obama administration, under your administration, thought about co-benefits from climate regulations and what the changes that EPA is proposing now would mean for public health.
Well, Lisa, very simply, we thought about co-benefits the exact same way that Ronald Reagan and every administration since Ronald Reagan's administration has thought about it, which is you don't ignore the full benefits of any regulation, nor do you ignore the costs of those regulations. And so for some reason, this administration is fully prepared to look at all the costs of a regulation, but they've decided that benefits like, and in particular, where this is most acute right now, is re-regulated mercury emissions from the utility sector. And the utility sector themselves did not want that rule to be relooked at because it already sunk billions of dollars into the equipment that was necessary to get mercury pollution out of the air, because mercury pollution is a neurotoxin that makes its way into our food system through fish, and it impacts, severe impacts on kids and fetuses. So in order to undo that rule, which they were still, the administration was still intent, even though the major utility lobbyists said don't touch it, in writing said don't touch it, they decided to go after it. And the only way that they could go after it was to actually eliminate benefits beyond mercury that the equipment themselves basically address. You cannot get mercury out of the air without also taking particulate matter. It's impossible. And so you always calculate that in a cost benefit because the co-benefits of putting that equipment on are gigantic. And why would you not look at co-benefits when you look at every co-cost? And so this has been a rule in the federal government for a very long time as an executive order and as rulemaking that govern Office of Management and Budget. And this administration just decided if I don't have to worry about those pesky benefits, it's really hard to put a cost on losing IQ points for our kids and calculating the mercury benefits directly. And so they decided to get rid of it in hopes that it would look like a more reasonable thing to do, when it really doesn't anyways. But they're trying to make that a new way of doing business, which is let's make sure we look at every benefit we can ever think of from a cost perspective, but let's make sure we minimize the kind of benefits we want to look at from a health perspective in the most ridiculous ways imaginable.
Thank you.
Could I just add, Lisa, could I just add that this stance, this attitude really starts at the top and pervades the system downward from the top through the people that the president puts in place in the departments and agencies. The reason we had the opposite in the Obama administration is that President Obama himself understood how and why science and technology matter to virtually every dimension of the national agenda, whether it's the economy, healthcare, climate change, the rest of environment, national security. Science and technology matter. When you have somebody at the top who rejects the basic proposition that science and technology matter and puts in its place the proposition that advancing the financial interests of the rich donors to that administration is the top priority, you got a problem. And again, it pervades the administration from the top down, and that's why we need a different administration.
Well, we're certainly going to get to, sort of policies forward-looking in a moment, but just sticking with the idea of co-benefits, the other side of this is a communications aspect, how we talk about the benefits of reducing fossil fuel emissions, the benefits of reducing pollution. Dr. Bernstein, when you and I chatted last week, you described some of your concerns with describing the benefits that come from climate regulations that address traditional pollutants as co-benefits. Explain to me where, and that was a communication issue for you. Tell me a little bit about how you would like to see policymakers communicate climate and health in a new way.
Thanks for that question, Lisa. So I've been thinking about climate change and health for about 20 years. And I've watched, and John Holdren mentioned this, 20 years ago, there was almost no one anywhere thinking about climate change and health systematically. You heard from Jonathan Pass. Jonathan is one of the really early folks engaged in this. But people were talking about polar bears, as Gina likes to talk about. They're talking about sea level rise. And then, at some point, right around, the early aughts, co-benefits was defined as a term. And in my view, that's putting the cart before the horse. When I am seeing a kid who can't breathe, Attorney General Healy talked about this issue of not being able to breathe. I've seen more children not able to breathe in my lifetime than I would like to ever see in anyone else's. The mother does not care about climate change. She couldn't give a hoot about what's going to happen to the planet in 50 years. She wants to know if her child's going to suffocate in front of me. And so when we talk about co-benefits, we're missing the boat. We're putting the cart before the horse. These aren't the co-benefits, these are the benefits. This is what people, everyday people, the people who we need to get on board to take climate action care about. And by calling them co-benefits, we suggest they're simply unimportant. The real problem is climate change. Now, I'd be the first to say that climate change is a huge health problem. You heard it's not just a health problem in general, it's a health problem for health care and people like me to do our jobs. I have colleagues in California right now. You'll hear from one of them this afternoon, Kari Nadeau, who are dealing with the wildfire smoke. There is nothing we can do for children, really, to protect them from wildfire smoke. That's the honest truth. We can keep them indoors, but for the children who are most vulnerable, the HEPA filters aren't available, and even if they were, they might not protect them. So we need to start talking real seriously about how we talk about health benefits and climate change. And we need to think real hard about whether people are going to care about co-benefits or whether they're going to care about their child able to breathe from the pollution that's generated by burning fossil fuels. And more importantly, we need to focus on the reality that 1 in 5 children in this country have asthma. These are children who wouldn't have had asthma. The best science we have, this comes out of Susan Annenberg's work at George Washington and others, the fossil fuel pollution in the United States is causing children to have asthma who wouldn't have had it. It's causing children to be born too early and too low birth weight. That means their lungs aren't going to develop well. And you know what that means? That means when they grow up, if heaven forbid we have another COVID pandemic, they're going to be more likely to die. Because we know that children who have impaired lung development are more likely to have chronic lung diseases in adults, and those people with COPD are more likely to have severe respiratory outcomes. So I think we need to think about the benefits we stand to gain through reducing air pollution, particularly for the most vulnerable, and talk about those as the benefits of climate action, because that's where people's minds are at.
So what does that mean from a, do we rhetorically then discuss climate change as the co-benefit, or is there, is there a new way of communicating this that you, maybe Administrator McCarthy, others have been chewing on?
I think, Lisa, if I might, I think it's actually pretty easy. Being a clinician, you learn pretty quickly, and smoking is a great example. I could talk till I'm blue in the face to someone, an adolescent, who started smoking, telling in 30 years, you're going to die from lung cancer. You know how well that works to an adolescent who's smoking? It's like asking them to smoke, more or less. It's almost encouraging them. You have to start, if you have someone who doesn't see the world as I do, which is I know that child is at great risk of having lifetime health effects, but that's not where their mind at. You have to meet them where they're at. So to folks in the United States and around the world who understandably, especially right now with a pandemic, with an economic recession, we have to understand where their concerns are. Now, the good news is that pretty much any climate action we can take is going to benefit their health right now. There are things we should be doing anyway. The diets, the reliance on single, user cars, all these things we need to change because we have an obesity epidemic that is decreasing in, lifespans of children in the United States. And so if we say, these are benefits for your health, and they say, you know what, there's another benefit. And oh, by the way, you're going to provide for a livable, more just future for your children. It's not about benefits and co-benefits. Co-benefits is a technical word that, in my view, tends to make the folks of people I care for, their eyes glaze over. We need to talk about the benefits of health actions, and we need to talk about providing for a future that we would want to give to our children, the future they deserve. So we don't have to talk about benefits and co-benefits. We can talk about benefits now that promote equity, that help children lead their fullest, most healthy lives possible, and provide for a future that we would want.
Super. I know we only have Administrator McCarthy for about 3 more minutes. So Administrator, there's a question that came through via email that I'd like to put to you. Is there any thought and to pursuing a regulatory policy or strategy that achieves far more public health protection than we currently have through an ambitious yet feasible secondary, this is going to be an in the weeds question.
Yeah, it is. I see it. Yeah, it's weedy.
For greenhouse gases under the Clean Air Act. Essentially the questioner is asking, a way to protect public health broadly from dangerous levels of climate change.
Yes, is the easy answer. There's lots of ways in which you could look at utilizing the Clean Air Act to try to reduce carbon pollution, which the Supreme Court and Ruth Bader Ginsburg, I thank her for being in the majority on this, helped us get through to understand that we have to regulate pollution that kills us, and carbon pollution is such a pollutant. We have looked at it, but in all honesty, Lisa, I've looked at it a lot and it keeps continuing to linger. That process is lengthy. It is time consuming. And frankly, the longer we delay taking action, the more difficult this issue becomes. So I think that is one of the most complex ways of dealing with it. Instead of going sector by sector to look at how you would set standards that are protective of health, and address climate change, as Ari said, you can get lots of twofers and threefers here, because anything you do to reduce air pollution is going to also take some of the sting out of fossil fuels and will head us in the right direction. But it's also investing in new technologies. One of the most exciting things is that when you start thinking about it, we need to boost the economy. If every penny we had to get us out of our economic doldrums that we are in because of this pandemic was spent on clean energy, you would get great climate benefits, you would restore the health of populations, and you would set our children off with a bright future. If we can just think a little bit firmer about what we want and demand it and spend money that way, bingo. We have hit that touchdown. So you can talk all wonky you want, but if it takes longer than 3, 4, 5, 10 years, I ain't got the time, and neither do any of us. So we got to go and hit the ground running right away.
It was such a pleasure to have you with us. Thank you so much, Administrator. And
thanks, team.
I'm going to, in our last 5 minutes on this panel, I would like to bounce off of the Administrator's forward-looking optimism and ask each of you, we don't know what November is going to bring, but if there was a single policy or regulation that would really most address this nexus of climate and health, where is it that you would concentrate? Can we start with Dr. Parikh?
From the AAAS's point of view, it's really about getting science at the table. So the transparency rule should not go into place. Is probably the very first thing, because that creates a logjam with a whole bunch of things behind it. So if you're asking for one thing, I would say that not happen.
It'll be in the courts, like a lot of the regulations that are coming out. Dr. Bernstein, what would be your number one policy focus?
Well, I think it's a price on carbon. I think we can talk about the best way to make that happen. I'm encouraged by the states that are taking action now, and there are obviously pros and cons of various ways of doing that. But I also want to make another more specific recommendation, and it really speaks to the moment. which is colleagues of mine in the Gulf Coast and California talk about how there are very few people who have been trained and prepared to deal with the health consequences of these events. I heard from Jay Lemery in Maura Healy's video. Jay's a friend, colleague, known him for a long time. And Jay is one of 2 people running fellowships. There are only 2 fellowships in the country that deal with climate change in medical practice. One is there, one is at the Beth Israel in Boston. We need to ask NIH to step up. We have essentially 0 funding from NIH to train people to do research. It is appalling to me, frankly, that we have everyone here saying climate change is a huge health problem facing the United States. And by the best estimate of the entire NIH budget, a generous 0.05% is focused on climate change and health. How are we going to train people? How are we going to do the research? How are we going to get people in public offices, both at the state, national, municipal level, to be able to respond, let alone prevent the threat of climate change if we do not invest in it? And I think it would be an important action of a new administration to set an executive order to direct NIH to focus on climate change more squarely in its grant making.
That's really interesting. Thank you. Dr. Holdren, close us out. Where would you put your policy focus on climate and health?
Number 1, restore respect for science at the top in both the White House and across the agencies. Number 2, build partnerships across levels of government, across the public sector, the private sector, the academic sector, the civil society sector, to innovate more rapidly in the domains of cleaner energy technologies. Number 3, do the same for investments in adaptation to the changes in climate that we can no longer avoid. Adaptation has been the poor stepsister of investments in emissions reduction. It is equally important because no matter what we do in emissions reductions, we cannot stop the growth of emissions and the changes in climate overnight. We have to fight it at both ends, both mitigation and adaptation. Those adaptation steps can do a lot for us in the public health domain, as well as in other aspects of climate change.
Wonderful. Really, the 3 of you left, I cannot thank you enough for your time and your excellent insights today. I want to tell the attendees there will be a short break now between this and the second panel, a 15-minute break, and the conference will pick back up again at 12 p.m. with the second panel discussion on climate-related health issues. Dr. Holdren, Dr. Bernstein, Dr. Parikh, thank you all so much for a wonderful discussion this morning.
Thank you.
Thank you.
Thank you.
Thanks for including us.